We wanted to offer some ideas that we had that can help people protect themselves during this time when there's a lot of concern with health and immune system. There's also a pretty big impact just from the level and degree of fear that's in the environment right now. Lynn and I are here in Doylestown, Pennsylvania, and we're pretty quarantined for quite a while. We're just starting to get outside again and see family, and that's been a nice change. But over the time, we've seen a lot of people trying to offer something that can be helpful in these times, and there's been a lot of good information. The information that I tend to lean toward is the information about natural techniques to protect ourselves. And I think also, in case somebody would contract this virus, that it would help them to go through it a lot more easily. So that's not known for sure. Lynn and I think that we have had this virus, being that we were up in New York in the late part of January. We went into a jazz club at that time, and we were around the city, and we had some symptoms that did seem to align with what they're saying the symptoms are. Of course, you have the ones that are very seriously ill, and then you have people that don't get any symptoms at all, and then there's a whole spectrum in between. There seems to be like a classic set of symptoms, and then other miscellaneous symptoms that people get, like extreme fatigue over periods of time. There are also some digestive or intestinal symptoms that are very unusual. Intestinal and abdominal pain, as an example, that is not common, but it has been reported to enough that they could say that it's part of what might occur. So there's the people that have symptoms for a few weeks, and then there are also those people that have symptoms for several months, persistent symptoms that I've seen reported. Anyway, so I'd like to put a few things on the table here that maybe can add to any protocol that you've come up with yourself for protection or for healing, or in these times, also for the people around you, of course. The first thing I wanted to talk about was the discovery that they've noticed in Germany, which is that good normal production of T cells is very helpful. Now, T cells became much more known during the AIDS era, and the whole AIDS research that went on, and some of the things and medications and drugs that came up to help to offset the AIDS infection, which is also a virus. And so they learned a lot about T cells, and they're also finding in Germany the proper production of T cells doesn't necessarily cure this problem, but it adds a very important layer of protection in the body. And so one of the things that we do in our work, which is called light body activation and proprioceptive exercise, is we activate the thymus gland. Now, T in T cells stands for thymus cells, and they are the ones that help to boost the immunity, and they also help other cells to have better immune capabilities. So we reached the peak of the thymus gland, which is located here at the top part of the sternum, or what's called the manubrium. And behind the manubrium is where the thymus gland is located. Now, in proportion with our body, the thymus gland is at its biggest ratio when we're about 2 years old. Then the body keeps growing, of course, but the thymus gland does not grow proportionate to that. Then what happens is the body keeps growing, and the thymus is not keeping up proportionally with it. And there's also been evidence that stress and the chemicals that are produced by stress, the reaction, the stress, flight, and fight reaction, also causes a shrinking or atrophy of the thymus gland. So it's important for many bodily functions, and we've also found that it's an important factor in healing at a distance or resolving communication discrepancies with the people around us. So we have a lot of videos and audios out with specific thymus gland processes. But I'll just say that you sit quietly and relax and breathe, and then you bring your attention to this area. And what you'll start to feel if you keep your attention there is that that bone will start to have a numb or tingling sensation. So once you get that, then it's like you know that you're into the program. And as you keep your attention on this area, what you'll notice is the numb and tingling sensation begins to penetrate. You'll feel it penetrate, and then you'll start to feel the numb and tingling sensation behind the bone. That's where the thymus is located. And so then there's other sensations that you might get. Different people report different sensations. You might even feel like something is opening there, like a flower, like a rose opening, some kind of movement outward. Sometimes it's a little bit of an aching sensation. But as long as possible, you keep that numb and tingling feeling, and you keep it there by keeping your attention there and relaxing. And once you get that feeling of the numb and tingling behind the manubrium, then you know that you've stimulated your thymus gland. So even without this whole virus phenomenon, it's a great practice anyway. And it's a practice that I've been using for a number of years, and I think it's very helpful. So I wanted to offer that to you, and that's a simple way to do it. You know, just spending a minute or two, 3 or 4 or 5. Once you get the sensation, it's a very pleasant experience, so you can stay with it as long as you want. But sitting down once a day, twice a day, and bringing your attention there, getting that sensation in the bone, having it penetrate to the tissue and mass behind the bone, then this can be highly productive and activating for the immune system and the T cells. So that's the first thing, is the thymus gland. Second thing I want to talk about is the digestion. Let's say a less frequent experience is discomfort in the digestive system related to this virus that's going around. And it can be really sharp, painful abdominal sensations. So the main thing with that and keeping digestion healthy is to eat good quality food. So that's kind of a given in the natural foods world. And it's very important at the same time to eat low mucus foods. So like cheeses and dairy foods, ice creams, things that are going to cause a lot of thick, high viscosity mucus in the body. Now, the body does need some natural mucus, and the way that you can get some of that is through eating grains and vegetables. I'm partial to the macrobiotic diet, but any kind of grain, vegetable diet as the basis would be good in these times. And the key also is chewing your food very well. There was another research that came out in France recently and also in the Netherlands, and what they found out is that the virus seems to appear first in the sewer systems of the cities. So they're now investigating that as an early detection possibility, and they're thinking it's pretty accurate, that it shows up in the sewer systems before there's an outbreak. So what that may indicate is that it's really generating more in the digestive system first, and then being excreted, being detected in the sewer system, but then the outbreak takes place, and it seems like the most common and the most serious aspect of this is the attack on the lungs. So having said that, then the next thing I'd like to talk about is breathing exercise. And this is really important if we have symptoms, but also for prevention. And any kind of breathing exercise really is helpful. But one that can be, I think, good for improving the power of the lung and the lung tissue is if we bring the hands like this. We clasp them, reverse the clasp up, and pull the arms all the way back. And you'll notice that puts a certain kind of tension down through the thoracic region. And then breathe in and push the air down into the lower lungs. Hold the breath. And then contract the muscles to move the oxygen into the lungs and into the blood system. So it's breathing in, hold, and push. Contract the abdominal muscles and breathe out. And you could do that 5 to 10 times. Another one is to breathe in, contract, but then and contract the abdominal muscles in this position. And what you're going to notice is that if you hold the breath and lean forward, the emphasis comes to the back. And that's the lower portion, the posterior portion of the lungs, where the most oxygen enters into the system. And they found that's also where the pneumonia aspect of this whole virus tends to be. That's where it collects, that's where the symptoms appear. And there's a lot of convergence of mucus in that location and a lack of flow of oxygen, which is, what the main, ultimately the main problem. Oxygenation is not enough in the body. So breathing in, hold the breath, and when you're forward, then contracting the muscles in the back. So that's an exercise. And then breathing out when you come up. And breathing out. 5 to 10 times, a couple of times a day. The thing is that in this time, people really have fear. There's a lot of nervousness, not only about getting the sickness ourselves, but for the people around us. So I think it's really helpful to know these techniques in case someone near you happens to contract this thing. Also, what they found out now is that possibly even more effective than a ventilator is having the person lay in the prone position and over some kind of surface like an exercise ball, so that it's basically like prone position, but with the back arched. And then if you have somebody that you're working with that's experiencing this sickness, just stroking the back tissue up toward the top of the lungs. And this is also helpful for moving the mucus that's collecting down here out of the body. And that leads me to the next thing, which is a remedy. Now, I already said that good quality food, low mucus content food, is very, very important at this time. But the remedy, and there's numerous remedies. There's herbs that are known. Elderberry is reportedly very good, and other herbs. But the one that I wanted to recommend was oregano oil. And this is something that you can use it as an herb too, but as a concentrated oil, it's probably going to be more potent in this moment for what's going on. And that, first of all, helps to dissolve mucus in the lungs. The second thing is it helps to remove dust-type particles in the lungs. And this is also some of the things that they find are aggravating this coronavirus condition. But also, the oregano oil has antiviral, antimicrobial properties. So you can go online, easily look up oregano oil. There's a lot of different researches about it. And I would really recommend that you add that during these times as a preventative, or if you have this condition, to add it to your protocol. Also, one other thing about this thymus activation that I talked about first, it will change the ortho and parasympathetic nervous system and help the body to produce more antibodies. And that's also something that's been researched quite well, because when you go into that state where you feel those sensations, then the nervous system is switching, and particularly like the pineal gland is secreting what would be antibodies and have also a preventative or immune type result. Okay, so great. Thanks for listening, and everyone, I hope you stay healthy and happy and enjoy your families and keep pursuing your creative work.